Hi guys, this is Professor Elliott. Today we're going to cover chapter 45, which is about cancer drugs. So this chapter involves chemotherapy, but first we'll kind of talk about some of the principles of cancer and then kind of some of the really big issues that happen with chemo for almost all drugs. So here's kind of what we're going to cover in terms of these cancer drugs. This is kind of a big chapter and it covers a lot of kind of difficult topics and some difficult drugs. So understanding the principles behind all of these, I think, are going to make your knowledge of chemotherapy better and hopefully apply this information to NCLEX questions. So what is cancer? Cancer is a cellular transformation. As you can see here, it's this uncontrolled and rapid cellular growth. So the cells normally stop dividing with this process called apoptosis. So when that doesn't happen with these cancer cells, they just multiply, multiply, multiply. They can get so big that they press on really important things like blood vessels, your airway, within your lungs, or pieces of that cancer can break off and go somewhere else in your body. So as we talked about, cancerous cells do not have growth control mechanisms. They don't have positive physiologic function either. There's no benefit of having cancer. So cancer cells, again, grow and invade adjacent tissues or break away from the original tumor and travel by means of blood or lymphatic system to different distant sites by a process called metastasis. So the way we treat cancer, and cancer can occur in any tissue, any area of the body. So we can do surgery to remove it. We can do radiation to shrink it and hopefully get rid of it, or we can use chemotherapy. Chemotherapy is what we're going to talk about within pharmacology. So we have some different classes of these drugs, and the names are kind of complicated, so don't get too hung up on those. But basically, we're targeting how these cells grow, and we're stopping part of that process. So we have cell cycle specific drugs. So within our normal cycle of a cell, which you learned about in biology, we stop some of those processes. We have cell cycle non-specific drugs. We have some miscellaneous. We have some miscellaneous anti-neoplastics. We can target hormones, and then we have some radioactive drugs. It's important to know that chemotherapy, all of these drugs have a narrow therapeutic index. So we know those drugs are very dangerous. Narrow therapeutic index means the level that is effective and the level that is toxic are very close together. A combination of these drugs is typically more effective than a single drug therapy, but nearly all of our drugs cause adverse effects. They cause adverse effects because chemotherapy is hazardous to almost all rapidly growing cells. So good for cancer cells, but bad for things like our hair follicles, our gastrointestinal cells, or the cells in our bone marrow. So if we think of kind of generally, if you've heard of chemotherapy, any of the side effects, we typically think of hair loss, maybe a lot of GI upset, fatigue. This all comes from that harm to the rapidly growing cells. So I've just highlighted some areas, so the hair loss, the mouth sores, nausea, vomiting, constipation, diarrhea. We can see some damage to nerves, trouble breathing. So there's a lot of effects chemotherapy have. The ones we're going to focus on right now are the hair, the GI system, and the bone marrow. So your bone marrow is really important, and I've alluded to this in prior chapters, but your bone marrow is the factory that produces all blood cells. So it starts out in the bone marrow. So our bone marrow creates these precursor cells for white blood cells. We know those are important in infection, red blood cells, which carry our oxygen, and platelets, which control our clotting mechanisms and bleeding. So if we're hurting the bone marrow, we can limit any of these cells or all of these cells. So you may see something called neutropenic precautions that you'll learn about further in the program, but let's think about this. So a patient who's receiving chemo may have this sign on their door. So it says you need to wash your hands, there can be no sick personnel or visitors, no plants or fresh fruit. So think about all these things. What are they trying to do? They're trying to minimize infection. right? We don't want anybody sick near these patients who have neutropenic precautions. So if the chemo is targeting these cells within the bone marrow and causing the decreased growth of white blood cells, the patient is going to be more likely to have an infection. So we would want to prevent any infection coming into that room. So antimetabolites are a type of chemotherapy. We give these for solid tumors, some hematologic or blood cancers. I am by no means concerned that you know which type of cancer these treat. The field of oncology is very vast. There's a lot of new technology that's ever evolving, but if you want to go into oncology, there are some specialty certifications. So I'll really highlight the main points of this chapter. And again, it is kind of it's a lot of information and a lot of kind of brain power that this chapter takes to kind of go over. So I will hit the highlights of kind of all chemotherapy drugs, describe specifics within each class if those are pertinent to know. So antimetabolites, these are kind of your cell cycle specific drugs. So they're going to work on preventing a DNA formation or this replication of the cells. You can see here adverse effects of this chemotherapy are hair loss, nausea, vomiting, diarrhea, myelosuppression. So if you see that word, again, it's the decreased bone marrow production of these cells. So within that antimetabolite class, we have folic acid antagonist. So with this, we're going to prevent the production of DNA. So the cell dies, which is great for your cancer cells, not so great for the other cells. So within this, we have methotrexate. All of these drugs have TREX in them. Methotrexate is one I think that may be a little bit more common. You may have heard of the other ones as well. So folic acid is really important. We learned about folic acid when we were talking about B vitamins. So methotrexate is something we can give. We can give it for its immunosuppressive properties. Patients who have autoimmune diseases may get methotrexate. So it is used for a few different things. So if methotrexate blocks this folic acid replication or production, it's going to hurt all of the cells in your body that need folic acid. So you may see methotrexate given with a medication called leucovorin. Leucovorin protects all of the healthy good cells in your body and allows the methotrexate to specifically hurt those cancer cells. So leucovorin is being protective to your healthy cells. We have purine antagonists, which again are within that antimetabolite class. It works with that interruption of the DNA process. So an adverse effect would be tumor lysis syndrome. The drugs are listed below. I wrote the indications for which we would use these chemotherapy agents. Again, I do not need you to know those. Pyridamine antagonists as well interrupt the DNA process, synthesis and the DNA replication. Listed the drugs down below. Remember, so let's look at that third one, fluorouracil is the palliative treatment of cancer. When we see palliative treatment, you're thinking something that's making the patient feel better, but it is not curing. So think of palliative care. Palliative is basically making the patient feel better, but not curing. So you may see that on some of these chemotherapy drugs. Another class is mitotic inhibitors. So they're working within that cell cycle, the reproduction of those cells and preventing that reproduction. Within this class, we have vincristine. We like vincristine because it does have a relative lack of bone marrow suppression. So it doesn't really get that bone marrow suppression. So what effects are you thinking you may not see? So you may not see the lowered white cells, lowered red cells, and lowered platelets with this because it's kind of sparing the bone marrow. So a client with ovarian cancer is being treated with vincristine. The nurse monitors the client knowing that which manifestation indicates an adverse effect of this specific medication. So diarrhea, hair loss, chest pain, or peripheral neuropathy. So with vincristine, almost every patient will have peripheral neuropathy. So that's a nerve tingling, burning, typically in the periphery. So you would get arms or legs. So with vincristine, you may see peripheral neuropathy in almost every client. With mitotic inhibitors, adverse effects again, we talked about that peripheral neuropathy. Extravasation is a big point here. Remember, extravasation is when you're giving something intravenously. So you have something that you're putting in somebody's vessel and in the IV route, and it leaks out. So it's not going in the vessel, it's going in the tissue around it. So let's say I have an IV in my arm. So if I have an IV in my arm and that medication extravasates, it causes damage to the nearby tissue. We talked about this when we talked about things like vasopressin. We talked about norepinephrine. So chemotherapy drugs can also create that extravasation, which makes it really important that we're monitoring our IV site with these medications. So some nursing implications specifically for the cell cycle specific drug that we just talked about. We want to assess our baseline blood counts. That's seeing what is the number for our red blood cells, our white blood cells, and our platelets in our patient. Because we've got to know what's happening in our healthy, basically regular patient before we give them a medication that's going to decrease their blood cell counts. We want to monitor for GI complications. Stomatitis is an irritation of the tissue in the mouth. Nausea, vomiting, diarrhea, ulceration within the GI tract. We need to implement measures to prevent infection in these patients. So we saw towards the beginning of this chapter that sign about neutropenic precautions. So if a patient has low white blood cell counts due to the chemotherapy, they're at risk for infection. So we want to protect them from that infection. And then we need to implement measures to protect and monitor for bleeding in our patient. And we want to look for anemia. Remember, anemia is low red blood cells. Red blood cells carry our oxygen. So if our red blood cells are low, we can see severe fatigue happening. We'll end with this question.